So with no further ado, I would like to go into the next phase of our presentations today, and I would like to invite the COMFORTage team to the stage, please. So I'd like to invite George Manias, if you would come and join us. I would also like to invite Athos Antoniades, apologies for my pronunciation, because we look very much forward to hearing about your part in this amazing initiative. Thank you, the floor is yours.
Thank you very much, Jennifer. Okay. Thank you very much, Jennifer, for the introduction, and Alina and Teia for these inspiring presentations with regards to why we need the aging deal, what is the purpose, the objectives of the aging deal, and of course, to see the perspective and the vision and the insights from the European Commission and how we have to align our purposes and our activities in the context of a better future for everyone, a healthier, comfortable, and safer and smarter future and aging for everyone. So, without losing more time, let's see how COMFORTage project seeks to tackle the challenges and the increasing needs of the aging population of Europe towards fostering personalized solutions for prevention of dementia and frailty. And I have together with me Athos Antoniades, who is the scientific manager of the COMFORTage project, and we will have the honor to represent and present to you our project. So, we will see an overview of the project, what is COMFORTage, what are the aging challenges that drive the creation, the design and implementation of our approaches, the multidisciplinary approach and methodology that we seek to follow, that we have designed and we will follow throughout the whole life cycle of the project, what is the patient digital healthcare journey that we seek to address and follow throughout this life cycle, and of course the different prevention stages that we foresee. So, what is COMFORTage? COMFORTage is a 48 months, 4 years duration project that has been funded under the Silver Deal call of the European Commission as presented previously by Alina. Currently, we are on the second year of the project, month 17 of the implementation of it, started on the previous January 2024. COMFORTage is a disease-oriented project because we specifically focus on tackling and improving the prediction, monitoring, and the provision of personalized recommendations towards the prevention and relief of dementia and frailty. And is a project with a large consortium, joint effort of 39 organizations ranging across 12 countries, but is a joint effort that brings together and integrates several different backgrounds, several different expertise, and as you can see, we have 12 universities in order to foster the research orientation of our project. I would like to remind you that we are a research and innovation project, so it's really crucial to improve both research, but also innovation and wider adoption of our solutions. That's why we have also big industries, SMEs that participate in the project in order to foster the exploitation of it and the innovative approach that we want to follow. And of course, towards tackling the challenges from clinical and societal perspective, we have medical clinics, we have geriatric clinics, we have hospitals, healthcare actors, but also social scientists, humanists, and social multipliers and networks in order to foster the societal perspective of our project. In a first glance, I know that this seems challenging. Having 39 organizations, more than 200 people working together is a challenge and a bit of complex approach. But this is also an opportunity for all of us, because based on the different expertises, based on the different backgrounds, we seek to the provision of a multidisciplinary approach, a holistic approach towards fostering the digitalization of the healthcare domain that was specifically highlighted by Alina. We live in an age where the digitalization, the digital transformation of the healthcare domain, among other domains, of course, is emerging, is very rapid. So we have to bear in mind that we have to foster digital tools towards addressing the challenges and, of course, tackling these challenges of the aging population, especially the ones that suffer from cognitive and physical decline. So, based on this, the heart, the core of the COMFORTage encapsulates an innovative approach and holistic approach that is based on four main pillars towards improving, of course, providing solutions that improve the quality of life and longevity of the older adults. These pillars are from technological, clinical, societal, and ethical perspective, because also we have to tackle trustworthiness in our solutions, reliability of our solutions, etc. And now, yes.
So, challenge. What's the challenge? We have to look at the last 50, 60 years of Europe and understand that we are a rapidly aging society. This is a recent publication that shows the median age of the European, and you can see Europe has the biggest problem and the biggest acceleration as well. So we are rapidly aging. So we need to come up with solutions that are going to support us as we age, because we are all aging, moving forward and reducing our impact. So what influences our quality of life and our health as we age? There are two specific categories of factors. It's what we're born with, it's our genes, it's our character, it's our attitude, our culture, and those things are very difficult to change. But then we have environmental factors as well. And there we can, if we understand how us as individuals are affected, then we can find environmental factors to offset our risks. And in this way, we focus on things like assistive technologies, transport, social facilities, and how digital technologies can come in and support us in having a healthy aging. We focus on quality of life. It's all about quality of life. Everybody ages. We're all going to age. We're all going to end our lives at some point. We don't just want to live longer. We want to live better. And that's the message that COMFORTage wants to bring. So in this recent Lancet publication, we like the fact that they mapped how you can make an impact on your quality of life over time if you make small changes early on. So it's all about prevention, intervention. And you can see that little things which I wish I could read, but unfortunately my glasses don't match this specific distance, as I am somewhere in midlife to older. But you can look at the risk factors of dementia, from depression, brain injury, simple things that you can take, physical activity. There are many things that we can do early on in life to reduce our risk and make an impact to our quality of life as we age. It's important that we educate the population. It's important that we provide the tools to the population, work with all stakeholders involved, including the citizen, to provide solutions. I loved the DigiConnect and the Hadea presentations earlier, because one of the keywords I heard was health budgets. If we all live healthier, we can help our healthcare systems actually provide better care for us, because we won't need them as much, and we can focus the care that we receive on things that there's nothing we can do about them.
And by presenting the challenges, and also, as Teia mentioned, one of the main objectives and scopes of the aging deal is to add quality and life as we are aging. And in order to do that, in the context of the COMFORTage, of course, we start by analyzing the challenges that Athos just mentioned and the needs of the increasing aging population of the European Union. We have also an increased burden from dementia and frailty. But also, if we are speaking from digital perspective, technological perspective, we have also very siloed approaches. Most of the times, we have fragmentation of the healthcare systems on the digital tools, but also lack of personalized solutions. Most of the solutions that have been provided so far follow an approach of one size fits all. This is not the scope. We have to foster personalization. We have to put persons, individuals in the center of our solutions in order to provide improved solutions and personalized solutions. In the COMFORTage, in order to do that, our vision and scope is to design a digitally enabled framework towards tackling the challenges of dementia and frailty, and fostering prevention intervention. In order to do that, we seek to leverage emerging technologies from the domains of artificial intelligence, from the domains of IoT, Internet of Things, cybersecurity, and other emerging tools, by always focusing on the provision of person-centered care, integrated care that leverages living labs, digital innovation hubs, patient digital twins, serious games, in order to foster the personalization of our approaches. In order to do this, we follow a methodological foundation that seeks on the analysis of the healthcare and societal challenges, structured in the 3 levels of prevention: primary, secondary, and tertiary. So this is how we have also positioned the project in order to proceed with the development of a holistic and integrated framework. And in order to accomplish our target and evaluate and validate our approaches, we have 13 pilot studies ranging across different perspectives, focusing on primary prevention, focusing on assessing the integration between dementia, frailty, other neurodegenerative diseases, fostering the leveraging living labs, digital innovation hubs, addressing multiple domains from biomarkers, genetics, multiomics, co-creation approaches that focus also on social activation and engagement, and towards also tackling the challenges and preventing unwanted loneliness on the older adults by integrating technical, clinical, and societal perspectives. Through this, we foresee a multidimensional impact on the clinical, technological, and societal landscape by improved diagnosis and personalized intervention and preventions, leveraging AI, decision support systems, IO, integration of smartwatches, mobile applications, and etc., in order also to deliver our solutions, and of course, towards empowering individuals, take active role in the management of their own life, as also Alina mentioned, improving digital and health literacy of the individuals, and provide digital inclusion and health literacy to everyone. Through this, our foreseen main offerings until the end of the project is COMFORTage to act as a reference model as an integrated framework towards dementia and frailty, and designed for scalability and real-world adaptation. In order to do that, we follow a concrete and comprehensive digital patient journey, starting from the identification of the needs of the individuals, moving to the collection of their data, integration, harmonization, transformation of their data, especially in the context of the holistic health records that we seek to introduce in the context of the project, and after that, leveraging all this information that we have in the context of the patient digital twins, in the context of clinical decision support systems, in order to increase knowledge, in order to increase awareness, better support healthcare professionals to provide improved solutions and personalized recommendations, and of course by providing delivery mechanisms. Through this, we are able to place persons, individuals, and patients in the center, and through this, we are also able to specify all stakeholders around this, that contribute around this journey towards the provision of improved and personalized solutions. And as stakeholders, we talk about healthcare professionals, researchers, caregivers, and etc. Through this, we are able to integrate and deliver community prevention intervention care in a holistic manner that leads to a healthier, smarter, and more comfortable aging for everyone.
So 39 partners, 13 pilots, and a 4-year project. That's massive. How do you manage it? Well, let's break down the problem. We need to have interventions. We need to have prevention interventions. But what's the best prevention intervention? Well, that depends on the individual. It also depends a lot on the age and the state of health of the individual. So we broke down our 13 pilots into primary prevention, secondary prevention, and tertiary prevention based on the state of health of the individual. And that allowed us to create categories for our prevention interventions, organize the pilots into specific targeted areas, and make sense of this. you can, the typical thing in EU grants and EU projects right now is let's throw AI at the problem. And I act as a reviewer quite often, and I see a lot of projects saying, we're going to solve this problem and that problem with AI. This is not the case here. There is a lot of AI that it's going to merge the data together, help us discover new knowledge, help us better understand the potential impact of each digital technology, how to improve it, how to design it, and how to make an impact. But you need the structure, you need to understand the literature today, you need to understand the science today, and design based on that. So that's what COMFORTage is doing here. So if you want to learn more, visit our websites and learn more about our pilots and the breakdown that we follow.
Thank you very much, Anthos. And of course, we invite you to engage with the projects. We invite you to engage with the aging deal. This is the first aging deal. We foresee in more events on this. Thank you very much.